The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Everyone who's joining, thank you so much for giving me the opportunity to educate some folks on erectile dysfunction, what it is, who has it, what causes it, and what can we do after the failure of oral therapies. What is erectile dysfunction? Quite simply, it's the persistent inability to achieve and maintain an erection adequate or for satisfactory intercourse. As you can see here with these statistics, it is quite common. 1 in 5 American men greater than 20 years of old experience some form of erectile dysfunction in their lifetime. This is a big one here. 50% of men, or a little bit more than 50% of men over the age of 40 have some degree of ED. Thankfully, it's not total or complete impotence, but it is some degree of erectile dysfunction. This is a little bit older stat, but 39 million men in America are affected by erectile dysfunction. What are some physical causes and associations or associated with erectile dysfunction? As you can see here, diabetes is high. Cardiovascular is also very high. The problem with diabetes is that it also affects the cardiovascular system. So these are somewhat intertwined. As you can see here, prostate and radical pelvic surgery, things like prostatectomy, colorectal cancer surgery, these can also cause erectile dysfunction. Some of them can be neurologic and others can be endocrine, with a very small percentage of other causes. Medications are also something to think about. There can be some blood pressure medications and some other psychogenic medications that can cause erectile dysfunction. What's interesting here off to the other side of the screen is the diameter of the arteries in the penis. As you can see here, that the penile artery is approximately 1 to 2 millimeters in diameter. And so when a young man, or any man rather, begins with erectile dysfunction, that may be the presenting sign of something more insidious or indolent going on, something that may have further problems, maybe a cardiovascular problem. And if you look at the very next diameter and artery, the artery that goes to the main blood supply to the heart is 3 to 4 millimeters in size. So reason would have it, if you're having difficulty with your erection with blood flow, then the very next thing to have an issue may be your heart. And there are some studies that show or indicate that erectile dysfunction is the main presenting symptom, and some men, thankfully not many, but some men can have a significant cardiovascular event approximately 3 years after the onset of erectile dysfunction. So the erection process, in order to figure out how we can treat erectile dysfunction, we need to first understand the proper erectile process. This is why it's important to understand this, is that diabetes can affect this entire pathway, and you'll see that here in a little bit. So when aroused, the nerves surrounding the penis become active. These nerves secrete neurotransmitters, okay? The neurotransmitters will then go to the blood vessels, and they relax the arteries, cause the inflow of blood, and start the erection process. The additional blood makes the penis stiff and hard or erect. In order to maintain the erection, the veins that allow the blood to leave are collapsed, they don't allow the blood to leave. And so anything in this process that affects this entire process can cause erectile dysfunction. That's why I mentioned about diabetes. Diabetes can affect both the nerves and the cardiovascular system. So it's somewhat of a double whammy. So how do ED medications work? What they do is they increase blood flow to the penis to achieve and maintain the erection strong enough for the entirety of intercourse. But what's important is that the pills need both the nerves to work as well as the blood supply. Now, who can treat erectile dysfunction? Is it only limited to urologists? I would say no to a certain degree. But as you can see here, your general practitioner or your family doctor can very easily give you oral medications for erectile dysfunction. A urologist is someone who has specialized training that focuses on surgical and medical diseases of the male and female genitourinary tract, as well as the male reproductive organs. So certainly that physician can help. And then a prosthetic urologist is what we would call an ED specialist. Prosthetic urologists have additional training specific to men's health and erectile dysfunction, and they specialize in the penile implant procedure. So what are some treatment options? That's what everybody wants to hear about. Briefly, we have vacuum erection devices, oral medications, intraurethral gels, injections, and penile implants. We'll talk a little bit about each of these here shortly. Vacuum erection device for sexual activity and for penile rehabilitation. In my own personal practice, I like to use it more for penile rehab, more so than treatment for erectile dysfunction or use to complement erectile dysfunction. So how does it work? It's a hollow plastic tube that's placed over the penis. There's either a manual or a battery-operated pump that is used to create a vacuum that pulls blood into the penis. It's nothing more than a mechanical vacuum that mechanically draws blood into the penis. Once the erection is achieved, the plastic tension ring is placed over the base of the penis to help maintain the erection. How effective is it? Patient satisfaction rates range from 68 to 80%. What's not included in this slide is a little asterisk that says, for patients who use it correctly. As simple as this looks and as easy as it looks to use, it takes a lot of patience and it takes a lot of practice in order to get this to work correctly. A lot of men get very frustrated with it and give it up very easily. What are some common side effects? It can cause blocked ejaculation. Again, remember that tight constriction band around the base of the penis that doesn't allow ejaculation. If a man can still ejaculate, think a man who has his prostate removed for prostate cancer, ejaculation is gone in that situation. If it's left on, if the constriction band is left on too long, it can cause penile numbness, bruising, and discomfort. So how does it work for rehab? This is where I like to concentrate my practice on. The vacuum device is used for 3 to 5 times per week for approximately 20 to 30 minutes each time without the use of the constriction ring. So all it's doing is drawing blood into the penis. The therapy can be used to maintain penile length for men with ED. And it is often recommended for post-prostatectomy or radical pelvic surgery. Again, this is my focus for the use of the vacuum device. I tell my patients to use it in the shower. Why? Because they're naked and the vacuum device is plastic. It can get wet. That's why I like to recommend the manual model, because that can go in the shower. The battery-operated one cannot, obviously. Many men will talk about loss of length of their penis after prostatectomy for prostate cancer, and that's not because your surgeon removed some of your penis when you weren't, when you were sleeping or during the operation, but atrophy sets in when you're not getting those usual erections like you were before surgery. It's very similar to if you break your arm and your arm is in a cast. You're not using your arm when the cast comes off, the muscles are atrophied. Another very common understanding is men who have had spinal cord injuries and are now in a wheelchair, or any patient for that matter in a spinal cord injury in a wheelchair. They're not using their legs, they're not walking on their legs, so those muscles atrophy. Unfortunately, the same thing happens with the penis after, or can happen to the penis after prostatectomy, and so that's what I think the vacuum device is very useful for, helping combat loss of length. All right, on to oral medications, or PDE5 inhibitors, or phosphodiesterase 5 inhibitors. This is what everyone is familiar with, or majority of patients are familiar with, the little blue pill, or Viagra, Cialis, also known as sildenafil and tadalafil. This can be effective for up to 75% of men with erectile dysfunction. Depending on the type of pill, dosage is a little differently, okay? For a sildenafil, you want to take it at least an hour to 2 before anticipated sexual activity, okay? Again, during sexual stimulation, the nerves will release these neurotransmitters that help relax the blood vessels and allow for blood to inflow to the penis. These medications help keep the blood flow to the penis for longer, okay? Again, that's why it says in that little slide it requires sexual stimulation. Like I tell my patients, you can't take one of these and go to a hardware store and expect to get an erection unless the table saws or all the power tools get you going. This isn't going to work. Okay, so there needs to be sexual stimulation. Sildenafil or Viagra is typically effective for up to 4 hours. The thing you need to understand about sildenafil is it has to be taken on an empty stomach, okay? So if you're going to do dinner and a movie, you have to get your timing just correct. You need to take it before you go to dinner, and you can't have a 7-course meal, or by the time you get home, it's not going to work. Cialis, on the other hand, can be effective for up to 36 hours. It's kind of that pill you can take on a Friday afternoon, and it's Good Friday, it's Good Saturday, starts to wear off on Sunday. The other thing to know about Cialis is it doesn't need to be taken on an empty stomach, so you have a little bit of leeway there with your dosage. It's important to know that if you take alpha blockers for high blood pressure, or in the urology world, we give alpha blockers for an enlarged prostate. These are things like tamsulosin or Flomax, Solodazine, Rapaflo, those types of medications. There is a theoretic drug interaction between sildenafil, tadalafil, and those medications. So you need to be very careful, and typically the thought is don't take them within 4 hours of themselves. If you have low blood pressure, these can affect that. And if you have uncontrolled hypertension, a very big contraindication to these pills is any nitrate medications for cardiac conditions. And if you do have nitroglycerin prescribed, I would strongly consider talking with your cardiologist or whoever about the safety of not taking that before you would take any of these medications. There are some common but mild side effects to these medications, things like facial flushing, maybe a little nasal congestion, blurred vision, particularly with Viagra, headaches, reflux or heartburn, and then back or muscle pain is typically with Cialis. All right, so some intraurethral gel. This is a needleless medication that can be used after pills fail. Next. So how does it work? It's a self-inserted medication with a pre-filled needleless syringe into the urethra, or the tip of the penis. The onset of the erection is within 5 to 15 minutes. How effective is it? It is more effective than oral medications, particularly when these medications fail, but less than injection therapy for ED. In the clinical literature, success rates are reported up to 65%. What are some common side effects? These are the big hang up why men typically don't like this. Is there can be urethral pain or burning with application. Very rarely have I seen priapism or a prolonged erection with this therapy, but be aware it can occur. And then how do you store this medication? Partially used or full syringes must be refrigerated, so you have to make sure you keep it cold so the medication doesn't expire. There are two types of medications. There's 1 and 2 drug gel available, and you can see them there. All right, so intracavernosal injection therapy. How do ED injections work? Again, the whole thing that we need to get and sustain an erection is increased blood flow. So these medications do just that. It increases blood flow to the penis to achieve and maintain an erection strong enough for the entirety of sexual intercourse. I like to tell my guys I like for them to have an erection for around 40 to 45 minutes with the injection. Okay, what are the formulations? You'll hear things like trimix and quad mix, that sort of thing. And so it's a combination. The trimix obviously is a combination of 3 medications. First being alprostadil or prostaglandin, the second one being papaverin, the third being phentolamine. Trimix is a mixture of all 3 of these. Bimix is a mixture of only 2 of these, leaving out the alprostadil. Some men prefer this because the alprostadil, or the prostaglandin E1, can cause almost an achy sensation in the penis, and a lot of guys don't like that. Some urologists also don't like to use the alprostadil because that can be the component that may induce some scarring with prolonged and repeated use with injection therapy. One quick thing to add about intracavernosal injection. You don't need sexual stimulation for it to work. In other words, if the injection occurs, you will get an erection whether you want one or not. You don't need the sexual stimulation to occur. So again, just to reiterate what we're talking about with bimix formulations and trimix formulations, again, bimix consists of the papaverin and the phentolamine, with the trimix being alprostadil, papaverin, and the phentolamine. Just as I mentioned earlier, the alprostadil can cause an achy sensation in about 20% of men, and so in this case, the options exist to either completely eliminate the alprostadil from the formulation or use a very low dose. of the L-prostadil, that is. Something to look at. This slide looks very busy with all these different formulations, and you say, oh my goodness, where do we go? How do we do this? That's the thing with injection therapy, is that there's no standard one-fits-all formulation. There can be many different manipulations, many different concentrations, and many different dosages to use. And so that's why this can be a little bit of trial and error. And what I mean is that you may need some dose escalation. The first dose you use may not give you the desired outcome. And so there's a lot of different manipulations that can occur. That's one of the things that MinMD is very helpful with. There are personal health assistants, and they can help you with dose escalation. They can help walk you through the process of doing that should you have any questions or concerns. All right, so how effective is it? Intracavernosal injection therapy is the most effective non-surgical treatment for erectile dysfunction. In literature, success rates are reported to be up to 90%. Are there side effects? Sure, there's side effects to everything. Priapism or prolonged erection can occur. Thankfully, with proper technique, with proper physician supervision, this is very low, on the order of about 1%. I can tell you in my practice, I've only had one guy that I've had to meet in the emergency room because of this. What are some other reported side effects? Penile fibrosis, scar tissue, hematomas, pain after the injection, local infections, curvature. I've certainly, while this is a possibility, I've not seen any local infections, honestly, with any of my patients. How do you store it? You need to store it in the refrigerator, and vials should be discarded about 28 days after the first puncture. What you see here down in the bottom of the corner is what I like to refer to as my penis clock. What you can see here is all the nerves, arteries, and veins are at the 12 o'clock position. The urethra, or the tube that you urinate through, is at the 6 o'clock position. So you never want to do the injection at the 6 o'clock, and you never want to do the injection at the 12 o'clock. Instead, where you want to do the injection is at the 3 o'clock or the 9 o'clock position, because what you need to do is you want to get the medication into those cavernosal bodies. Those are the tubes that the blood flow goes into during the erection. This picture is a little, it's not obviously a true anatomic figure, because the skin in the penis is not that thick. What's important is that you need to get the needle into that cavernosal body, or that pink area. And so if you inject under the skin, it's not going to do anything to help you get an erection. In fact, it does cause a little bit increased pain. So you want to make sure you get it into the cavernosal body, or that pink area, at the 3 o'clock or the 9 o'clock position. There is a demonstration at some point in this slide, and I'll show you a little bit more. All right, so following intracavernosal injection therapy, we'll talk about penile implants. So how does it work? There are a couple different kinds of penile implants, but the one that you see here on the screen is what we would call an inflatable 3-piece penile prosthesis. Okay, there are a pair of cylinders that are implanted into the penis, a pump which is placed into the scrotum, and then a reservoir of saline which is placed into the lower abdomen next to the bladder there. If you refer back to that picture that we just had on the screen, there are 2 cavernosal bodies in the penis, and so each cavernosal body gets a cylinder. How does it work? Squeezing the pump down in the scrotum will transfer fluid from the reservoir into the cylinders. And then once you're done using, or no longer need the erection, there's a little deflate button. You push that, and that reverses the fluid. It causes it to leave the cylinders, go back into the reservoir. How effective is it? The satisfaction rate between patient and partner is greater than 90%. The best part about it is when you want an erection, you pump it up, and off you go. If you do have retained ejaculatory function, it does not interfere with ejaculatory function. Essentially what I mean is, again, if you've had your prostate removed for prostate cancer, ejaculatory function is gone. However, the climax and the orgasm sensation is still present. Sensation in the penis is still present. And then at 7 years, greater than 90% are still in use and don't need any type of revision. All right, so again, I want you to take notice to the 2 cylinders, one in each side of the penis, and then the pump in the scrotum. The skin is obviously clear here, but everything is all on the inside. It's very concealable. As you see him pump it, it transfers the fluid from the reservoir, which is by the bladder, into the cylinders. And then when he no longer wants the erection, he pushes that deflate button. The fluid leaves the cylinders, goes back into the reservoir, and the penis is back flaccid again. I hate to use the term normal and natural, but the three-piece implant does provide for a very concealable, natural-appearing penis only because all of the fluid in the flaccid state is in the reservoir. During the erect state, it's in the cylinder. So again, it's a very normal/natural-appearing erection. It's important to know that surgical procedures all have possible risks. Some physicians recommend attempting less invasive ED treatments before choosing the implant option, while other physicians don't view ED treatment choices as linear pills to implant. Essentially, if you fail on the pills, you don't have to fail in every successive treatment. You can move straight to an implant if you so desire. But again, that is a discussion that you need to have with your physician. Health insurance coverage may vary. Natural or spontaneous erections are not possible. In other words, once you get an implant placed, you can have it removed and then have your natural or spontaneous erection. It is a mechanical device, and so mechanical failure may occur, and so there may be need for revision surgery. Okay. Pain or infection can occur typically during the healing process. Thankfully, with implants these days, particularly Boston Scientific and their antibiotic-coated device, infection risk is about 2%. Thankfully, in my own practice, I've seen an infection rate of less than 1%. Men with diabetes, spinal cord injuries, or open sores may have an increased risk of infection. And again, this is something that you need to ensure that your physician knows that you do have diabetes or any type of systemic infection. In other words, if you have a non-healing ulcer on your foot and you come in with your shoes and your surgeon is not able to see your feet, you need to make sure to bring this up to their attention. For more information about penile implants, a very good website is edcure.org. I do encourage everyone to go to that website. There's a ton of good information there.
This is our sponsor slide. We'd like to thank Boston Scientific for sponsoring this wonderful event tonight.
All right, perfect. So when you order your injection therapy, you're going to get a little bag of 31 gauge syringes. These are insulin syringes. The thing that you need to see with your syringe is how big is it? This is a small little 50 unit syringe or a half a cc syringe, okay? That's important when you're going to use your auto injector. This is a very handy auto injector here. And what you need to look at is there are 3 different tips here, and these are for the different sizes of syringes. So we have the 50 or 0.5 ml syringe, so we're going to go ahead and put that on our auto injector here. When you go to draw up your medication, what I don't have here, I don't have any alcohol swabs, but I'm going to use this as if it were an alcohol swab. What you want to do, you want to take your alcohol swab and clean the top of your vial. Very simple. Everybody's seen this in the movies, and if you go to the doctor, a very similar setup here. When you go to draw up your medication, this is a vacuum, okay? It's much easier to get something out if you put something in. So what I like to do is just draw back a little bit on the syringe with a little bit of air, put the needle in, inject the air, and then draw back my medication. I'm going to use a little 10 unit or 0.1 dose. Once you do that, you want to put your cap back on. Now, again, back to the model here. Just like when you go give blood or labs, they use an alcohol swab and they clean off your skin. So we're going to do the same thing here before we do the injection. What I find is that it's a lot easier for men to pull their penis off to the side, and then that way they're going straight at their penis rather than pulling their penis away from their body, and then they have this awkward angle that they have to do. So pull your penis off to the side, and then that way you're coming straight back at your body. I hope that makes sense. It's a little different here with this prop doing it somewhat backwards. If you're going to use this auto injector, you want to leave the cap on, place it in the auto injector. Let's get it seated in there. You get it seated in there, okay? You want to go ahead and deploy it first, and then you pull off your cap. You pull it back, and now you're ready to go. What you want to do, again, pull your penis off to the side. I'm going to put it at the 3 o'clock position, and I'm going to push the button and then inject the medication. And that's it. There's not a whole lot to it. Alternatively, if you don't want to use the auto injector, again, what we're going to do is I'm just going to drop some medication. I'm going to forego using the alcohol swab. Get your dose. Again, pull the penis off to the side. You want to make sure you put it all the way in and then inject. I like to do the first injection in my office just to show the guys how to do it, show them how it feels, make sure they're very comfortable with it. If I inject 10 guys in the office, 5 will say they didn't feel it, and the other 5 will say that it wasn't that bad. So it's really, I understand guys with fear of needles, but it's really much better tolerated than you initially think. Yeah, so what I have here is a 3-piece inflatable prosthesis. It's obviously hard to tell that there's anything inside this model, but the pump is right here, and so you simply just pump it up. Fluid is currently leaving the reservoir, going into the cylinders. And you want to keep pumping essentially until you fill the cylinders all the way. You say, well, how do I know when all the cylinders are filled? There's so much pressure in the cylinders, you just simply cannot put any more fluid in there. And so you just keep pumping up. And that's it. You can leave it up for as long as you want. When you're done, on the same pump, there's a little button. You push it. The fluid is now leaving the cylinders, going back into the reservoir. Some men will squeeze the penis to help speed up deflation. And that's it.
First question here, how can one naturally restore blood flow to vital areas that enable an erection?
It really depends on the etiology of the decreased blood flow. If it's a new diagnosis of diabetes, working with your provider or physician to really improve your diabetes, improve your glucose control, do what you can to really decrease the damage that can occur with uncontrolled diabetes. If it's hypertension or uncontrolled hypertension, you certainly want to get that under control. There is some very weak data, but there is data nonetheless improving your lipids or your high cholesterol. So really, what you want to first do is correct anything that needs correction, and sometimes that will help. If it's due to a medication, you need to speak with your provider about maybe switching medications or coming up with a different treatment regimen that may decrease the incidence of erectile dysfunction from a medication.
Alrighty. Next question here. Is there such thing as being too old for ED treatment to work?
There is not. We've put implants in men 80-year-old plus. So no, I would not say that there's someone too old for ED treatments.
Alrighty. Next question here. It's a two-parter, but the first part is, please explain venous leakage and how this affects ED and the corresponding treatments.
Sure. So when we talked earlier about the erection process, in order for the erection to occur, we need blood flow to go in, and we need it to be trapped. So at a certain pressure inside those cavernosal bodies, the veins that drain the blood in the penis, because of the increased pressure in the penis, are pushed on the outside wall. and they don't allow blood to leave the penis. What happens in venous leak, that blood cannot be trapped into the penis. So it's not so much a blood inflow issue, it's the inability to completely trap the blood in the penis. Venous leak is fixed with either a constriction band or a penile implant.
Awesome, thank you. That answered the follow-up. The follow-up was going to ask how you fix it, so got that one right there. Next question, is it best to regularly ejaculate by yourself?
There's really no data that I'm aware of that says that that's a good health habit to have. But sure.
Next question. I am 65 years old. Is it worth me trying to have sexual happiness at my age?
Yes, I would say yeah. There shouldn't be a barrier to sexual happiness with age. 65 is very young these days, so absolutely.
Next question here. This person would like to know what can be done to improve overall libido.
Overall libido is very tough to improve. There are many things that can cause a decrease in libido. Something as simple as being stressed out at work, or having long work hours, or even stressors in other avenues of life. Not a good diet, a lot of different things, lack of exercise, lack of sleep. All these things can contribute to a loss of libido. Another thing that can cause decreased libido is low testosterone. I don't want to get into the weeds with testosterone, but sometimes testosterone supplementation can help improve libido. And there can be some medications that can decrease libido. So again, this certainly is not just a one box fits all decreased or low libido. There can be many different causes of this, and I strongly encourage you to reach out to your provider.
All right, certainly. Moving along to some questions about PDE5 inhibitors. The first question here is, why do these oral medications for ED become ineffective over time?
That's an interesting question. I hear that quite often. To my knowledge, there's no good data to suggest that there's something called tachyphylaxis or lack of efficacy as time goes on. It may not be something with them not working as much as there can be decline in nerve function, or decrease in your cardiovascular health. So it may not be particularly to the medications. It may just be either advancing age or decline in either nervous system or cardiovascular function.
Certainly. Next question here. This person says, when I use ED pills, I tend to bleed during ejaculation. It happens almost every time, and especially with Viagra. Why may this be happening?
Blood in the ejaculate is typically from prostate inflammation. There's no direct correlation that I'm aware of that causes what you're talking about as hematospermia, or blood in the ejaculate, in PDE5 inhibitors.
Alrighty. Next question about PDE5s. Are there any other medications that someone may be taking, prescription or non-prescription, that could prevent ED pills from working?
No, there's no, outside of those interactions that we discussed, there's no medications that I'm aware of that if men are taking these along with the PDE5 inhibitors would cause them not to work. Again, most often the pills don't work for diabetic men for the reasons we discussed earlier.
Alrighty. Moving along to some injection questions here. The first one that we have is, this person wants to know, does drinking alcohol impact the effectiveness of trimix injections?
Drinking alcohol in general can decrease the efficacy of a lot of different things. I would encourage you to not heavily drink with the use of trimix injections, but certainly I think a cocktail or two wouldn't cause much of an issue. But again, certainly discuss this with your provider before you go doing all this.
Alrighty. Next question here. This person says, I feel like my penis is not getting enough blood after injections. What can I do about this?
So again, injection therapy is not just a one-stop shop with a single dosage, a single concentration. There can be a lot of different dose manipulation, dose escalation, and a lot of different ways that you can manipulate things to improve the efficacy of the injection. So certainly talk over with your provider the concentration, the dose that you're doing. Typically, what I tell my men is that when we start on a dose, if you don't get the desired outcome, I'm okay with you increasing by increments of 5 units until we have an agreed upon max dose that you can do without calling me. And then once you reach that dose, then give me a call and we can further discuss and manipulate the concentration.
Alrighty. Next question here. This person says, what can you tell me about quad mix? The trimix formula did not work for me.
So the quad mix actually is, urologists were very simple people, and so bimix is 2 medications, trimix is 3 medications, quad mix is quite naturally 4 medications. The 4th medication is something called atropine, and what that does is it helps improve smooth muscle relaxation to allow improved blood flow, and so certainly adding another component to that injection should improve the blood flow to the penis and improve the erectile rigidity.
Alrighty. Got a injection storage question here. This person wants to know if it's okay to freeze and refreeze your trimix.
Yes, so I don't have any issues. I'm not a pharmacist or a compounding pharmacist, but for me, I'm okay with my men putting it in the freezer. You need to make sure that you take it out several minutes before you need it, because it will need some time to thaw and then place back into the freezer.
Certainly, and you want to make sure that you're not extending the use over those 28 days. Let's see, so got through all of those. Got some questions about scar tissue from penile injection therapy. To my understanding, that's something that's common with people that use this therapy for many years. So this person wants to know if there's any way through exercise that you can reduce existing scar tissue.
The short answer is no. Once the scarring is there, it's unfortunately there. However, use of a vacuum device or the VED, the penis pump that we talked about earlier, can help soften some of that scarring and may make it not as, or maybe help improve the blood flow a little bit. But unfortunately, once the scarring is there, it's there.
Alrighty, we're gonna move on to some implant questions now. So saw this more than once, talking about the general requirements to be a candidate for an implant. So we obviously mentioned that you probably shouldn't have any underlying condition that could affect the procedure, but I think people want to know, like size-wise, if there's any requirements there to get an implant.
There's nothing specific to penile size during the penile implant surgery that would discount anyone from having the operation. Every time we do a penile implant surgery, it is the implant is measured specifically for that patient, and a bespoke or a custom-made implant is put in. Custom measured, I should say, implant is put in at the time. And so no, to answer the question directly, there's nothing regarding penile size that would discount or discredit someone from having the operation.
Alrighty. So next question here, this person wants to know how long after the surgery you can resume exercising.
Yeah, so every case is a little different, but what I like to tell guys is I like them to lay low for about 7 to 10 days after the procedure. Some guys obviously much sooner can get back to normal activity, some guys a little bit later, but a very safe bet is around 7 to 10 days before you can really start getting back in your exercise routine. I will tell you that the guys that heal the fastest are the guys that have the least amount of swelling. Oftentimes the guys that have the least amount of swelling are the ones that kind of lay low for those several days after the procedure.
Alrighty. Next question here. That's a bit of a review question, but saw it a couple times. Do you still have an orgasm and ejaculation with a penile implant?
Assuming you can still ejaculate, again, back to the whole prostate cancer prostatectomy issue where those patients do not, but they still have feeling in the penis, they still have the sensation of orgasm, just no ejaculation occurs. Oftentimes, diabetic guys will have impaired ejaculation. So if your ejaculation, hate to use the term normal, but if your ejaculation was unimpaired prior to the operation, then yes, it should be still intact after the operation. There's nothing specific to the operation that causes a man to not ejaculate.
Alrighty. Next question here is, I guess, about some qualifiers for the implant. This person says they're 76, they're in great health, but they had their prostate removed and have ED. They want to know if they're too old for an implant.
No, the short answer is no, not at all. We put implants in men in their 70s quite frequently.
Alrighty.
So no, to answer the question, no.
Why can't you go back once you've had a penile implant?
Okay, very good question. So when we put a penile implant in, we aren't removing any erectile tissue, but the analogy I like to use is if you cut a watermelon in half and then you just take your finger and you stab it directly in the watermelon, and you take your finger out of the watermelon. You're not removing any of that meat from the watermelon, but there's a nice divot on the inside of the watermelon. That's kind of what the cylinders do. We're not removing any of the erectile tissue, but it's a soft, spongy tissue. So when we place the cylinders in that erectile tissue, it essentially pushes it off on the side, and it just doesn't function as it did prior to the penile implant surgery. And so again, that's why it's very important that you meet with your physician or provider about a penile implant surgery, because again, if you really don't have poor erectile function, there's really no reason to get a penile implant.
Alrighty. Next question here. Will an implant fix a slight Peyronie's curvature?
It can. It can. For men who have poor erectile function and Peyronie's disease, the best treatment for those guys is a penile implant. And you say, why? Well, we can treat the erectile dysfunction and we can treat the curvature with the implant.
Alrighty. Next question here, saw this multiple times. Is the sexual sensation after the penile implant the same or different?
It's the same. It's the same. Guys, after the implant, tell me that there's no difference in the sensation, and we're not doing anything to the nerves of the penis to affect sensation to the penis. So it should be the same.
Saw this a couple times. I guess a lot of insurance companies they refuse to pay for the implant surgery unless it's medically required. So what is required to have your implant as, how can you get that medically required and covered by insurance, in other words?
Man, I wish I could answer that question. What I'll tell you, what I think is medically required is never medically required by the implant company. The good news is that Medicare does cover the implant. There is positive coverage from Medicare enrolled patients. Commercial, it's all over the place. Where we are here in Louisiana, it's very challenging with a very large insurance company that covers many lives here in Louisiana. And so unfortunately, I don't have the answer. If I had the answer for that, I'd be doing, double the number of implants on an annual basis. It's unfortunately a game that insurance companies play. Well, I can't tell you that they're playing, but it's very challenging sometimes to get them covered, despite what I would consider something medically necessary.
So we'd like to thank Dr. Mutter for taking his time to present tonight. We'd also like to thank everyone for listening in and attending this MenMD The Focus webinar. We hope you found it informative and that you'll join us again in the future. If you'd like to learn more, you can go to the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. You can also call MenMD at 857-233-5837 or log into the secure MenMD portal to schedule an appointment with a MenMD personal health assistant. If you'd like to compare any of the treatment options we covered during tonight's event, you can do this by going to menmd.com, navigating to the ED condition page, scrolling down to the treatment section, selecting up to 3 ED treatments to compare. Finally, you can learn more about penile implants and insurance coverage by visiting edcure.org.